This is an installment of Staying Safe in the Hospital, a guide for older adults and their families.
Hello, my name is Dr. Ethan Kumbler, and I'm the Medical Director of the University of Colorado Acute Care for Elders Service.
And I'm Liza Klar, a nurse who works on the Acute Care for Elders unit at the University of Colorado Hospital. We are here to talk about delirium.
Let me start by telling you a story of one of my patients. He was a 77-year-old man, largely healthy, although he had been noticing some memory issues and had an appointment to see his geriatrician about it. He came in with bleeding from a stomach ulcer. He was badly anemic from the blood loss and needed a blood transfusion. We could even see on blood tests that the anemia was putting stress on his heart. He went down to have a camera look into his stomach to see where the blood was coming from. He got some sedatives for the procedure. On his way back to the hospital room, he was more confused and had a completely out of character, angry outburst at the nurse transporting him. That night, he kept hearing knocking at the hospital door, but his wife didn't hear anything, and when they opened it, there was no one there. They both found this frightening, but for different reasons. The next morning, he kept drifting off during our discussion and didn't know what day it was. His wife was very concerned and asked me, "Is he losing his mind?" What he experienced is called delirium. Delirium is a state of new confusion that occurs in some patients who are sick and in the hospital. The patient with delirium will typically be confused, have trouble paying attention, seem forgetful, unusually sleepy or overly excited, and sometimes experience hallucinations. It can be very troubling to see someone you love experience delirium, and some patients with delirium find the experience extremely distressing themselves.
Delirium is also associated with outcomes that no one wants: remaining longer in the hospital, higher chance of going to a nursing facility afterwards, and even a higher chance of dying. Here is what no one tells you: how common delirium is for older adults sick enough to end up in the hospital. Approximately 1 in 5 will have delirium at some point. The risk is higher for people with underlying memory problems like dementia, and if you are talking about older adults, such as those sick enough to be in the ICU, more patients will experience delirium than will come through without it.
So what causes delirium? Well, delirium can have one big thing that triggers it, such as a bad infection, or can have many contributors that combined put too much stress on the brain. The more of these factors that are present, the more likely delirium is to happen, kind of each one being another straw putting stress on the camel's back.
So how do we prevent delirium? Family can help a great deal. It is important to keep your loved one oriented. Talk to them about the date, where they are, what is going on, and opening the shades in the hospital room during the day. If they use sensory devices at home, such as glasses or hearing aids, it is valuable for them to use these at the hospital as well. Partner with the nursing team to see how you can safely help your loved ones stay active, hydrated, maintain good nutrition, hygiene, temperature, and get good sleep at night. Turns out that doing these simple things can significantly reduce the risk of delirium occurring in the first place.
The next thing that family can do is to let the medical team know if your loved one's thinking is different than normal. You are the experts in knowing what your loved one is like at baseline. Tell us if you're noticing a change, even if it hasn't caused problems.
Once delirium is present, what can families do to help? First, recognize that you can be a calm, reassuring presence. Talk to the charge nurse to see if family can stay overnight. This can be ideal to help keep them safe. The confusion often is worse at nights, and patients can fall when they try to get out of bed alone. If you know any breathing or relaxation techniques, practice them together. I don't know for sure if it is effective, but I love it when family brings in a picture from home for the bedside table, a quilt from their bed, or even their regular pillow, something reassuring and familiar.
And remember that some of the medications that may seem helpful at home or in the hospital can make delirium worse. For example, we avoid most sleeping pills other than melatonin in the hospital. You can ask your doctor to have a pharmacist review the hospital medication list to remove medicines that worsen delirium.
What we know is that delirium gets better. It can be hard to predict how long it lasts. For some patients, only a day, for others, many, but it does get better. The best thing is often to fix or remove as many as possible contributing factors and get back to a more familiar environment to rest and heal.
We have now talked about one of the most common, yet least talked about problems that happens to older adults in the hospital: delirium. What it is, how to recognize it, and what you can do to help.